Just so, ladies and gentlemen, just so you wonder why we're sitting here aimlessly just at this moment, we're just waiting a couple of minutes for an attendee to come. Good afternoon, ladies and gentlemen. I think we'll make a little bit of a start. So welcome to County Buildings in Staffordshire for Health and Wellbeing, Staffordshire Health and Wellbeing Board on the 12th of June this afternoon. So first item on the agenda is apologies. Liam?
Thank you, Chair. I've received apologies from Councillor Heasom, Councillor Atkins, Councillor Young and Ian Reid.
Thank you. And do we have any declarations of interest from anyone present? Okay, I'll take that as a no. And then item 1C, the minutes of the previous meeting that have been circulated. Are we happy with the accuracy of that? And is there any matters arising? Okay, I will take that those minutes have therefore been accepted. Any questions from the public, Liam?
Thank you, Chair. I've received no questions from the public.
Okay, thank you. So item 1E is for your information item only, and that's the health and wellbeing strategy, the quarterly data. There is a link in the papers so people can have a look at that if they haven't already at their leisure. If there is any feedback, please feed it back to us by all means. And in which case then we'll move on to item 2 and proper, which is healthy weight priority and a progress update from Tony Bullock. Thank you, Tony.
So just a quick refresh for members of the group. This is a programme of work. We've been back to Health and Wellbeing Board 2 or 3 times over the last few years. So the backdrop is that healthy weight's an area of public health that had been neglected nationally really until the pandemic, that I think really brought into focus not just the health consequences of excess weight in particular, but also the knock-on effects in terms of absenteeism and the effects of COVID. Since then, we've tried to build some strategic infrastructure. I think the comparison views previously is that it's a similar problem to smoking, very high levels of prevalence, and there's no quick fixes in the similar way that we had with smoking rates in the 1980s. Reductions in levels of smoking over the last 30 years have been a huge success, but it took a long time and it took lots of different levers to make it happen, some at a local level, some at a national level. And I think we've got a similar situation with obesity and healthy weight. What we didn't have a few years ago was any real strategic infrastructure, by which I mean partnerships, action plans, KPIs, a real work programme. And that's what we sought to put in place. So a whole system approach to obesity or healthy weight, because it's not just about obesity. We want to ensure that people are not underweight as well. So we've set up the county-wide partnership that operates on a regular basis, around 60 different members from lots of different organisations, which reflects that it needs a multidisciplinary, multi-organisational approach. And then the task was to localise this and try and establish partnerships in each of the 8 districts and boroughs with 3 pathfinder areas in Cannock, the Moorlands and East Staffordshire. And that's gone broadly well. We've made a bit more progress in some areas than others. 2 or 3 of the other districts and boroughs have come on board, and the others are in early stages of negotiations to establish partnerships, often using existing structures. We don't want to create lots of new meetings for the sake of it if there are structures that can be used at a local level. So the partnership, the county-wide partnership is well established. The partnerships in the districts and boroughs are progressing as well as we expected them to do. So that's the sort of foundations of the long-term approach. There's also a whole series of projects that should have an immediate impact, and I think they're listed in the appendix of the paper. And there's 3 priorities for the year. Continue to embed the partnerships is obviously an important part of it. We've also, as a county council, we've allocated some money for a digital platform. The approach that we're taking isn't to fund expensive services to address the problem. I think there's lots of opportunities for people to eat healthily and exercise in the county. One of the key challenges is to get that information, advice and guidance to people in the appropriate way. So we've allocated some funding for a digital platform that should really help with that IAG effort. We've also identified school meals as a real area of opportunity to make a difference with young people. A working group has been established across a number of agencies to work with schools and the providers of school meals to try and improve the nutritional value. And there are a couple of funding streams as well, one from the Health Inequalities Directors Group that's already funded a range of projects, and there's some funding from the Public Health team at the County Council that's has or is about to be released to voluntary sector to support initiatives, not just around healthy weight, but broader agenda. So we recognise that this isn't a problem to throw money at, but small amounts of money help to galvanise some of those activities at local level and help to galvanise the partnership as well. So there's a whole series of short-term pieces of work that are underway, whilst that longer-term sort of strategic infrastructure is in place as well. We're not really at the position to bring hard and fast metrics to be able to say prevalence rates have changed on the back of the activities yet. I think it's too early for that. But we've got clear, demonstrable action plans and systems in place and people working together, which I think is the start of that long-term approach. So I think we're reasonably pleased with where things are. We always want to do things faster and bigger than we perhaps have. But I think the programme is broadly where we would expect it to be at this moment in time.
Thank you, Tony, for that. Questions? Anybody got any questions at all? If not, I will start. A couple of things that I picked up. The first one is the prevalence of ultra-processed foods, which I've seen quite a lot of. There's quite a lot on digital platforms and on the telly about the amount of fat, all sorts of hidden sugars, salts, and all those sorts of things. Is that something that we've been trying to, in whatever way, involve in this to encourage people not to use those where possible, and also around what we're doing around children between that sort of reception and year 6 to 2 ages in which they get weighed, don't they? Because I understand between those two, the amount of children that are overweight or obese rises substantially between, so basically a primary school, isn't it? So I wondered whether within what we're doing, there's anything in those two areas.
Yeah, and I think the ultra-processed food is one of the key issues, and I think we're hoping nationally at some point that government can support us with this. I don't think that's happening at the moment. I think our role in this is to get that information out to people so people can make the choices for themselves in a more informed way. So through the partnerships, we're trying to get those messages out, and the digital platform that I mentioned will hopefully help to get those messages out. We've done a whole series of campaigns to raise awareness, to drive people to the information that is out there, but it is one of the key issues. And unfortunately, they tend to be the foods that most people enjoy, and trying to persuade people to eat other foods is a real challenge. Again, there's no silver bullet ways of doing this, but that constant stream of education, whether it's through schools, whether it's through the sort of social media channels that we've got, they're the sort of messages that we are trying to convey. The childhood obesity rates is a key issue, as you identify, and it does increase. We can map as kids go through school how those obesity rates increase. We do have a specialist service for this. As I say, services aren't the whole answer to the obesity problem, but we do have a child weight programme that does work with children at that age, and we've increased funding to that over the last few years. I think that's an area to expand, and the work that we're doing with the school meals isn't just about the provision of school meals, but about that broader education to the young people. So I think the team have been tasked to come together to look at an issue in one of the districts and boroughs and to support agencies there. So I think there's going to be some focused work in the area that was flagged up. Having said that, there's issues across the whole county as well, but we will respond to that particular district and borough.
Thank you, Tony. Any further points or questions? Anybody? Phil.
Thank you, Chair. Tony, I was just wondering, you mentioned the similarity between this kind of generational campaign and smoking. Obviously, I think one of the key things around the smoking was that there were the national kind of health warnings, key messages across TV, cinema, etc. Is that something that's lacking at the moment in terms of supporting the local approach? And is there anything we can do about it?
I think there were some proposals that nearly reached fruition that weren't actually implemented. I think lobbying from the local areas to the centre is something that I think we should do, where we've got opportunities to do it, to demonstrate that there is a real push from local agencies for central government to make a change. I think most of the key organisations that work in the field are calling for the sort of action that you described, and I think if we've got opportunities to lobby central government, we should.
Neelam?
So the World Health Organization report, which was being publicized on the news this morning, did pick up certainly alcohol, processed food, lack of activity and smoking as the four main factors affecting the population all over the world. I just wonder whether we do make use of licensing at all in terms of outlets that are allowed to open or where they open, and that kind of issue.
I think there are programmes of work, and there's colleagues in the public health team working with our districts and borough colleagues. My understanding is that in theory, yes, there's levers. I think the practical reality is it's very difficult. My experience with alcohol licences that it is very difficult for districts and boroughs to take action unless there's very specific evidence. And I think it's equally difficult with fast food outlets, particularly now as a lot of food's delivered rather than people actually going to pick it up. So yeah, I think there are some powers with licensing, but I don't think it's straightforward and quick and easy matter to implement.
Sorry, I was just thinking on that point, Neil. I wonder if it might be useful. Sorry. So as Tony referenced, the members of our team are working quite closely with planners in some of the districts and boroughs, particularly thinking about the local plan, so that the sort of planning document for the sort of 20-30 year period, and how we can embed health into sort of policy and strategic decisions within that, so that that's in as part of the sort of structure of all of those decisions from the very beginning. As Tony said, it's quite difficult to sort of refuse a new license based on health grounds specifically, because health isn't one of the licensing objectives, although it is in Scotland, I believe, and I think maybe Wales. But there are things that can be done. There are sort of representations that can be made, and sort of building that evidence base and supporting partners that can make those representations is important. So I just wondered if it might be useful to bring a bit of an overview of the health in all, kind of health and everything we do sort of approach to this board at some point, maybe as a bit of an update.
No, that's a good point, Claire. I welcome that. Okay, thank you for that. Any other comments on that? Okay, in that case, I take that as a no, and I think the ask was just go through the recommendation. We'll get there eventually. Okay, so the board was just to note the progress made on the Better Health Staffordshire programme and continuing to encourage your individual organisations to support the programme. I think we've done that. So, Tony, thank you very much for that. The next item, which is the Staffordshire Joint Strategic Needs Assessment. And that was perfect timing, Emma. So, over to yourself.
Yeah, I'll just, no, it's okay. I'll just give a bit of a sort of an intro, if that's okay. So yes, as you're all aware, because you've had some update papers over the past few months, the ambition sort of collectively across the partnership was to develop an interactive JSNA product. So the result is a Power BI dashboard to allow us to have something that's automated, so in terms of the sort of effort that has to go behind that to keep this kind of product up to date, because obviously the data continually changes and the indicators evolve, have something that draws that data through automatically to try and minimise the effort in the background, but also to try and help people to be sort of self-serving in terms of their data needs, so to have something that has filtering opportunities, has more granular level data to allow people to look at that, and hopefully it's fairly intuitive so that you can then decide what you need to know, look at the data on the dashboard, and then it also has small bits of information around sort of the indicator itself and some interpretation. So the process we've worked through to date, again, most of you will be aware, the J bit of the JSNA is joint, so we've always struggled in the past to really kind of achieve that with previous JSNA products for various reasons. So Emma and I have worked really hard over the past few months to have more of a partnership approach to developing this, and that includes the indicators that are included. So they have been developed and agreed with the steering group of multiple partners and representatives from across different directorates in the council. And the result, the demo that Emma will show to you in a minute, is the result of all of those conversations. And this is effectively the sort of working product that we have now. We were really keen to get this to the board at this stage to allow members to have a look at where we're at, see if it feels like it's something that's likely to be useful, see if the format and the sort of language of use and the approach we've taken is useful, intuitive, accessible, I guess. So really keen to get everybody's feedback after this meeting. We'd be encouraging everyone to go away and have a little play, have a tinker with the dashboard, see if it makes sense to you, and if there's any feedback you would like to give before we finalise this. So at the moment it's not live on the Observatory website. We wanted to give this board the opportunity to have a look at it and give us feedback first. So that's kind of where we're at. We will then, as I say, adjust for any sort of final amendments that need to be made and some of the final sort of formatting adjustments just to make it really polished. You'll also see in your pack a summary, a sort of interpretation document, so I'll let Emma talk to that in a bit more detail. But what that does is provide some of that high-level overview. So the data is useful, but if you're not familiar with the data, it doesn't necessarily tell you or sort of answer those so what questions, I guess, in terms of what does that mean for Staffordshire and what do we then need to perhaps respond to, or where might our gaps be, or where might our greatest areas of need be. So that document provides an overview of the data that's contained within the dashboards at the moment and a little bit more just because we had sort of additional data available for this product. So those two things combined are available now to you. Like I say, not published any more widely at the moment. I'll let Emma give a quick demo and then we can take some questions, and then I'll provide an overview of sort of next steps, if that's okay, at the end.
To move one of the boxes out of the way. Okay, so we've got the 4 initial chapters starting with our population demographics one. So all of them have got like a front page like this. And then if you click along, you can see that there's a table of contents. So I'm not going to go through every single page because otherwise you'll probably be sitting here till midnight or something. But I'll show you the first one so you can kind of get an idea of what this looks like. So we've got something here on population, and basically that gives a sort of breakdown of the population, and there's some graphics there so you can see between men and women and the different age groups there are. And at the side there's a selector, so you can highlight the district to bring up the district's total as well, and it displays which district it is on the map, so you can see where it's near basically. So yeah, so if you just change, you can go through all of them. So that's, I thought of if I show you this one, because I think I quite like the way the graphics are on this for the population demographics. So like I said, we've got 4 chapters so far. The next one is a children and young people's one. So there's a wider range of indicators on this because it's something that is quite important in public health in terms of best start in life. So I'll just highlight a couple of things here. So we've got our under 18 conception rate. So you can see by the districts and then the averages for Staffordshire and the West Midlands. And at the top here, you can go down through the years. So you can see how those districts have changed throughout the years in a sort of annual basis. So a little bit like a trend against all of those. So it just demonstrates which have got higher and lower areas. If you look at the bottom, there's some key messages and then a bit of a rationale about why the indicator is important. So when you get the link sent round, you'll be able to have a look at this and see whether that looks understandable and whether it's, it tells you about the charts basically. So there's a little thing at the top here, so you can move back, and then I'll just select another one. So like infant mortality, so you can see trends over time. And then again, you can change the district here. So you've always got a figure for Staffordshire, West Midlands and England, and then you can look at where the districts are in relation to that, and that changes. You've got the data that's populated on the table and how similar that is to the sort of national average for the districts in Staffordshire. And if you highlight here, it brings up the actual figure. So you've got the actual figure itself to tell you, what the figure is for the district, England, Staffordshire, and that. So it just basically goes to show all the areas for that. What's the next one? So, sorry, it's difficult to see my tab. Oh, hang on. Just trying to get the next one along. What's that? No, that's population. Sorry, I can't see the top of my screen because I've got this thing in the way to move on to the next tab. Hang on. I'm just going to stop sharing a minute so I can get the other one up. Excuse me. Okay, so I'll share again on the thing here. Okay, so this is one for working age adults. So again, it's a similar format to the other ones. You just click and then there's there's like a contents page. So you can highlight different indicators here. So there's one we've got here about prevalence of depression. And again, it shows you the trend in Staffordshire and how that relates to you know, West Midlands, England, but also each district at the top you can select, and you can see how that's changed over time. So this is like quite a key indicator for us because the rates have increased over time with this one, so it's something that, you know, we might want to look at more. And then there's more. There's these which are self-harm and suicide, and you can select again those at the bottom for the trends there and the trends at the top for that one. So if I just skip back, things like physical activity and obesity here, and again we've got the breakdowns of these for the different charts, the ones at the top for physical activity and then adult obesity at the bottom. So you've got those over time, and like the other ones you can still highlight all your figures if you want to access that too. So I'll just skip quickly on to the Ageing Well excuse me, chapter. So there's a list of different things down here that we've included as this. So again, I won't go through them all, I'll just pick one here. So diabetes is second, and you can see here this is slightly different because the diabetes data is taken from health data, so it's the former CCG areas, but they do fairly roughly correspond with some of our districts. So you can click along the top and find, you know, the difference, and that changes for both of the top and the bottom one when you move along with it. So there'll be a chance to have a go with these dashboards. It's probably a lot easier for you to see everything because the text is small on that screen, and like reading things on a big screen isn't always the best. So you'll be able to go in and have a look, and it would be like really helpful if you could have a look at the text, if you can have a look at if it's understandable, if everything works, because this is what we're trying to do, iron out any glitches that we have in our data sets basically. And then also if there's things that you think might add value to be included, we can have a look and see. There isn't always indicators for everything. We have to find things that we can measure on, but if there's something that's available, we can always put things into that as well. So that's kind of like an overview of what we've got so far in terms of this. I'm just going to stop sharing the screen because and shut that down. Okay, so I think it came with your packs. There would have been a summary document that came, which is just sort of like a couple of sides for each section. So it's got a bit of population, children and young peoples, working age adults, and the older people's section. So what we've tried to do with that is not basically outline every single indicator that's on there. It's more general than that. So we've tried to sort of highlight some key things about the data that we've got, and maybe some other sources of data that we know are having an impact or are likely to be an impact in Staffordshire. So if you look, for example, in the population section, we're really sort of looking at the projections around the older age population, and you know how important that is then, you know, for people to be healthy basically. Younger people, children and young people, we sort of highlighted some of the key issues of children and young people's around some of our indicators. I think things like infant mortality and some of the like smoking and pregnancy areas where, you know, as public health, we can really try and work on smoking and pregnancy, for example. So that's quite important there. Then we've got stuff around sort of working age adults, and that sort of looks at, I guess, you know, long-term conditions and the kind of underlying conditions that people would have, which will go on into older age. And then obviously older age groups, and we've looked at, you know, in the data set we've got things on place of death, that kind of stuff, and how it impacts, you know, in utilisation of different services. So what we tried to do, like I say, was just highlight the key issues and then put them into a bit of context about Staffordshire, and then a sort of paragraph on what that means for Staffordshire. So it's quite high level. But we have got plans to develop this further, which we're planning out at the moment. And Claire, did you want to talk about what we've got in the pipeline, or do you want me to say something? I don't mind.
No, I'm happy to, that's
Okay.
fine, yeah. Do you want to take any questions first at this point, Mark? Do you think, yeah?
Perhaps we can take some questions. A couple of questions from myself while other people think about it. You mentioned in one of them towards the end, it was the data was across 4 CCG areas. Yes. I didn't think we had CCGs anymore.
No, we don't, because the data for this is, I suppose some of the data doesn't run up to current, because a lot of the public health data is on an annual basis, so it only goes up to a certain point, and I think they probably haven't got to the point where they've done it for the ICB. So we've used that data because you get a more local picture. So if you do it for the ICB, a lot of the data we've got now will come through for Staffordshire and Stoke-on-Trent, which I'm aware will skew Staffordshire's data in a way. One of the things we were, Claire probably mentioned, we're going to do more locality profiles, looking at sort of more district level and lower level data on that. And I think some of that will unpick more, if you see what I mean. But we have to start with a level whereby we can sort of see what's going on across our population overall. Because when you start to look at the districts, there's quite different issues in each of them. It's quite startling in a way. So.
If you turn your mic off each time, sorry to be a pain. The other question I had was about, obviously we got the 4 key areas, and I understand why we've chosen that. When it came to the individual lists in each of those, what criteria did you use to decide on what they were? Were the ones that were the biggest problem, basically?
So the indicators, you mean the chapter headings, is that what you're talking about? How are they defined? Or
if we take, for example, children's, you've got infant mortality, and then a list of about 13 things, and you've got the same for each area. How did you decide on that list?
That was what Claire mentioned at the beginning. We had groups of, we had a steering group, and then we had separate groups working on each chapter, so children's and adults and older people, and they were from different sort of like different partners and from within our own organisation, who, you know, people who actually work in the area of children's or with adults. And between us, we came up with the things that they thought were important to become the kind of contents list, if you see what I mean, plus stuff that we knew was sort of health and wellbeing board priorities as well. So it's come from multiple people, and that was sort of done in a sort of consensus to come up with things that would be useful. But it's not exhaustive. If there's things in the future that aren't there, some of it might be because there's no data available, but some of it is because, you know, like I say, this is something that you can continually build upon. So if there are other things that become important, I mean, you're right, because there's clearly some things there where we need to focus on, you know, because the indicator says we're not maybe as good, or for another reason that we're looking at something locally. But say something else cropped up that was becoming an issue, we could always add that into the chapter if it's something is available and robust to populate it with.
No, really, I suppose I was just looking for some reassurance that, you know, there was some relevance, and it wasn't just that a group of professionals thought that was a good idea, you know, and by doing it the way we've done it, we didn't miss anything, you know, and the critical issues that we perhaps need in there are in there. And none of those would have been, you know, maybe because they're too difficult to do anything about, and people, you know, being a bit cynical, but maybe people didn't necessarily want them in there, and wanted things in that might be easier to fix, in inverted commas. I'm not suggesting that took place, but it's, you know, I find it strange there wasn't a set criteria that those groups work to.
People would have done it in the partnership, because different things are important to different people, if you see what I mean. But yeah, I think with some of the, like you saying, these things have been missed. Generally, we had a look at like a really wide range of data. So if something's been missed, a lot of the time it's because there isn't anything available that you can measure in a way that would highlight it. I think going forward, the way we develop this, there's probably more opportunity to put stuff in that isn't in a format that's easy to display like that, to broaden things out. But I don't know, I mean, and this is why it's really important for everyone to have a look, because if there's things that you think are clearly missing that we could populate with something, that would be useful for us to know as well. Because we have spoken to people in districts within our organisation and within other organisations as well. So it wasn't just us sitting here in the local authority. It certainly wasn't just me and Claire making a list of things together.
I think it's an important challenge, Mark, because there's various ways of producing something like this. There isn't a sort of very clear list that we're given as part of the sort of mandate of producing a JSNA that says it must include these indicators. So they are variable up and down the country. So for that reason, we looked at examples from elsewhere that we felt were good practice and have tried to sort of model those. and then use that as probably the starting point for those conversations with the steering group to say, okay, well, this is what Walsall have done, this is what Birmingham have done, do we like this, does this feel like it's relevant to us, are these indicators important to our partnership, does it align with our priorities? So all of those processes, which is why it's taken quite a while to sort of get to this point. So all of those conversations were had, and then on top of that, there were criteria applied in terms of the robustness of the data and the rigour that was used in terms of identifying indicators that we know were reliable. The data would be routinely sort of pulled through where we know it had been cleansed at a national level. So that's why it's high-level population sort of indicators at this point. At some point in the next sort of phase, we will likely try and drill down and do some more localised data and certainly some deep dives as well that I'll talk about in a second. But it was as rigorous as it could be in terms of a sort of collaborative process, and as Emma said, the consensus was reached on this list that's in here now, but it's by no means exhaustive, and we expect this very much to be an iterative process so that the product will evolve and develop continually. It will never be finished as such. So at some point in the next year we might decide, you know what, that indicator is actually not really that helpful, or we're not confident in the data that's behind it, we don't feel it truly represents the picture in Staffordshire, let's remove that one and add this one. So those conversations will continue to happen.
Okay, thank you. Any other questions on that, Rachel?
Yes, looking at the dashboard really going to be really useful, and in our health arena, enjoyed working with you. So and I really like the way that you're sort of going around the map and being able to drill down into those populations at a more local level. It's just a question around the long-term conditions, because I can see that diabetes in there, and it's clearly a significant condition within the county, and we know that the rates are going up in a very rapid way. I think when we're talking about things like smoking and activity, in terms of those long-term conditions, it feels like cardiovascular might be an appropriate one to put in there as well, because that we know we're an outlier in terms of blood pressure treatment and things. So although diabetes is an all-encompassing multi-system disease, it feels like cardiovascular would fit really well within that grouping as well.
Sorry, I'm really keep forgetting this. Basically, we had to use what was available on fingertips at the moment to do this. Because of the way that it's kind of formatted and validated, like Claire was saying, I wanted to make sure things that were in there are robust and reflective of stuff that's gone through certain process. I would agree hypertension would be a really good one to put in, because it's such a big population that it covers. Again, if there are suggestions for things and we have actual data that we can put in here in a format that matches, I'm more than happy, because Sam and Matt and co at the ICB, via them, I'm sure we can come up with something, and it wouldn't be too difficult to put into the thing going forward, because I do think there's probably more with that. It's just basic things like understanding the source, what that means, whether, because there's different ways of doing some of the long-term condition stuff, but if they're confident and you can put it in, I haven't got a problem with that at all. It'd be good.
That's great. I think that view came from, we've had a values pack around opportunities within the county. So yeah, it'd be good to link up with you around that. Okay, thank you.
So unless there's anyone else, just the last question. Oh, Neil, I'll bring you in first then.
So one was really a general question and overview in terms of how well do all the partners really use the joint strategic assessment when they are looking at any service development. I was just looking at the life expectancy and the variations amongst the districts and how it's changed over the last decade. And earlier we were talking about the weight management, and all those relationships, whether we, make really good use of this information and tie it up with what else we're doing. My other point was more specifically about the children, and I appreciate its work in practice at the moment, but I felt it doesn't quite have the richness of the data for children, and I was specifically thinking, say, of the SEND inspection, which might come any time. And I was thinking, if I was looking at it from that lens, what would I gain from this assessment, and whether there needs to be some more richness about particular aspects of children.
Okay, in terms of the SEND, there's a separate section, I think, that's been built up for that particular reason. So that's something that's been addressed slightly separately, because this is like an overall arching, sort of quite high level. Claire will explain in a bit about our future ambitions to maybe do more topic-specific work, but for the moment, we didn't want to populate it with too much of one thing and then not enough of the other. It was trying to get a really good spread, and colleagues from Children's Services have fed into this. So on the first issue around districts, I think that's a really, really good point, because they are doing a lot of planning around sort of health inequalities and stuff at the moment, and I've spoken to 4 of the districts already about the work we're doing and gone through some bits of data and stuff, and it's been really productive, and people have been really interested actually in how they can use that to help shape some of their thinking, along with some of the work that's been going on at the ICB as well. So I think I've not had much experience working with them, but I think that's been quite positive, so we'll continue that, yeah.
Thanks, Chair. Clearly within the document, there's some of the main key drivers of improvement going forward lie within the district and boroughs. And Claire mentioned earlier about through the planning process, what district and boroughs can do in relation to some of the causes. And I just wonder, how can we be assured that the information that gets down to the district and boroughs that is actually going to be used in the right way to actually forge ahead and make some of these improvements, and we will be asking them to sort of demonstrate what they've been doing, or show us in some sort of meaningful way what improvements have been made? Because, as I said, with a lot of it sitting within the districts and boroughs, they really are the drivers of a lot of this, particularly through the planning process in relation to cycle paths, walkways, and in relation to where fast food outlets are placed. Bearing in mind, we accept the present premise that a lot of people have it delivered now, that sort of food and that type of thing. But I do think there is still a big part that district and boroughs need to step up and engage and do that, because I think that's where it needs to start, really, in those early parts of the planning, particularly.
Sorry. Like I've just said, I've been to see 4 of the districts and boroughs already to talk through some of this and how it relates to what they're doing. So I think there is an interest there, and they seemed really keen to keep that dialogue going. I'm more than happy to go and speak to people again, or if individuals at the districts and boroughs have got a question about stuff and how it relates to what they're doing, happy for people to get in touch, no problem. And I agree, because some of the things that I say, a lot of the planning that they do and how sort of things are developed are really, really important to support some of this work, particularly around cardiovascular and obesity and some of the things what you've been discussing already. So yeah, I agree wholeheartedly, and certainly from our department, not just me, but others are regularly in touch with them. And I think because of the pandemic, we've got more and more contacts there, which has been really useful. Certainly, I've got to meet people at all the different districts, which I didn't have before. So yes, there was something positive about the pandemic in that respect. So yeah, I'd like to say happy to help support people's questions on that in the district, no problem.
So I'll come to you in a second, Rita. I suppose the question I have is, I suppose the so what question. So when we've got this all finished and it's done and it's accessible, it's about encouraging everybody to utilise it and use it across the whole of not just the county council, across the districts and boroughs, but all the partners that are involved to use this to influence and help to direct what they do or don't do. Perhaps you can have a little think about that, Claire, and I'll let Rita ask her question as well.
It's not actually a question, it's a comment. I think this just demonstrates how important it is to work with partners. And I know at South Staffs, and Mark will bear me out on this, the amount of work that's been done for localities. And if you drill down in there, the amount of information that's available to cover all this, there's an absolute wealth of information that you could use. And also, you'd also be more than welcome to attend one of our Wellbeing Select Committee meetings to do a presentation.
Yeah, I'm happy to take you up on that offer, and I'm always happy to work with any groups or staff who are looking at using stuff. And if there is information, actually, I mean, Claire, like I keep saying, Claire's going to talk about the future developments, but that's sort of more local level is something that potentially we could pick up and use, for some of what we're doing going forward. If we can get together and see what there is, I don't see a problem with that at all. Thanks.
Thank you. Yeah, I think that's the important question, isn't it, really? Because we've had JSNA products for a long time, and I think we publish them, we all look at them and agree them through these boards, and then I'm not sure they get looked at much after that. And I think partly that's just because it's very difficult, because they become immediately out of date as soon as we publish them, so people are less confident in using that data. So hopefully we overcome that slightly by having this automated product where the live data is pulled through every time it's updated. I think we would, when we're comfortable that we've got the sort of polished version that we're all happy to publicise, and ideally once we've got sort of those district profiles embedded within this, we should sort of present it and promote it as far and wide as possible, and really encourage people to utilise it for some of that informed decision making and some of that strategic and sort of policy making. So we're already scheduled to attend health and care scrutiny, I think it's July, is it, Emma? To do a bit of an introduction and kind of almost a mini training session to members of the Health and Care Scrutiny Committee, so that they can utilise this product and this tool as part of their role. So not just for interest, but so that they can actually draw down and look and interpret and analyse that data. We would also potentially then take it to places like the Leaders Board and maybe the ICP. So thinking about some of those very high-level strategic partnerships where we could air this and promote it. But also then I would probably want to go out to each of the locality partnerships within the districts and probably the Health Inequalities Directors Group as well, Tim, maybe to sort of make sure we've got that widespread awareness of it and talk about the opportunities for people to use it to inform what they're doing. That would be my sort of ambition, really. Shall I wrap up?
If there's no further... Oh, yeah, Rachel.
Could I just invite you to the that we've got the Health and Care Senate, which is the subcommittee of the ICB, and it's a virtual meeting, but it'd be great to have that there. So I'll be in touch. Thank you.
Yeah, absolutely. Thanks, Rachel.
So if there's no other questions, then Claire can sort of wrap up. Thank you.
Yes, thank you. I'm conscious we've just nudged over the agenda item by a minute, so I'll keep it brief. So really useful conversation, thank you. As I say, we'll send out the links to this sort of live working product for you to all have a look at, and some information about how to give your feedback. Genuinely be as honest and open and sort of critical as you feel you need to be. It is a complicated process. It does take a long time to get these things working in the background, so it doesn't look like much at the face of it. So sometimes things just aren't possible for technical reasons or data quality reasons, and if that's the case, we'll be honest about that. But please do have a look and give us your feedback. As I say, this is sort of phase one and was only ever going to be a high-level kind of population overview. I think the real useful and kind of meaningful data comes when we start to drill down a bit more, either into specific populations or specific diseases or issues that we want to look at in a bit more detail. So SEND, for example, NELAM is one that's on the list for a sort of deep dive, and that will have its own chapter. So we can really look at that in a lot more detail, and that's already being worked through in terms of the indicators that will be included there. We have NELAM, just for assurance, got a sort of static page for an update on SEND, just for the sort of holding position now, but that will be built on over the next few weeks. So as Emma has said, we'll work on specific community and district profiles, so we've got that sort of local focus. And by community, I also mean we might want to look at specific populations or communities across Staffordshire where we don't feel we necessarily have a very good understanding, or whom perhaps aren't featured within our data sets as much as other populations or other communities, and where it'd be useful for us to do that more in-depth analysis, potentially including some qualitative and kind of ground-up insight as well. So where we might want to look at particular populations where we know access to our services are perhaps more limited or aren't representative. So that's something else that's kind of on the plan as well. And as I say, it will be continually evolved and developed alongside the sort of health inequalities work that we're doing with the ICB and other partners as well. So I think that's probably as quick as I can make it. Happy to take any further questions outside of the meeting or just have any other conversations if people would like it, but otherwise I think that's probably it for the item.
Okay, Claire, Emma, thank you very much for that, and we look forward to that going live and moving forward, and the recommendation in there in the papers. I think we've clearly exhausted this afternoon. So that moves us on to the next item on the agenda, which is the Children's Safeguarding Board, and we've got, I think, Ian join us remotely to present that. Is that right? Can you hear us, Ian? We can't hear you, unfortunately. Sharon, can you hear us?
I can hear you.
And we can hear you, Sharon. Excellent. Ian, so that makes me presume it's something at your end.
It's my end. Can you hear me now?
Right. Right, so Ian, Sharon, thank you. Welcome to Staffordshire Health and Wellbeing Board. So over to yourself.
Thanks. Thanks ever so much. Mark, just to introduce myself to you in the room and to colleagues, first and foremost, so my name's Ian Varnell. I'm the current independent chair and scrutineer of the Staffordshire Safeguarding Children Board, and my colleagues can introduce themselves to you.
Good afternoon, I'm Sharon Conlon. I'm the Associate Director for Safeguarding at Staffordshire and Stoke-on-Trent ICB.
Good afternoon, my name is Colin Mattinson. I'm the Chief Superintendent for the Public Protection Unit in Staffordshire Police.
And I'm assuming our colleagues from the local authority, Children's Social Care, is in the room, Mark, as well. So just to obviously to give the opportunity for colleagues to have and review the annual report, the Safeguarding Children Board annual report, which is 22-23, recognising, of course, that it's a significant period of time since that report was concluded. And I will just very briefly update for colleagues in the room the current position with regards to the safeguarding arrangements and safeguarding partnership. Obviously, for colleagues, the Working Together 2023 was published in December, and that has placed a different perspective in relation to the safeguarding arrangements which will impact on Staffordshire. First and foremost is in relation to the roles of the chief officers, and that's the Chief Constable of Staffordshire Police and the Chief Executives of the ICB and the local authority, and their role being much more prevalent in the arrangements as the lead safeguarding partners. They delegate those arrangements to, in the police, is Colin. In relation to Children's Social Care, it's the Director of Children's Services, and then to Heather in the ICB. Obviously, that means that the new arrangements have to be shifted, and that includes the removal of an independent chair. So my role will cease at some point, and for colleagues in the room, we have to provide an updated annual report for the Department for Education by September of this year. And that obviously means that we've got some activity and action that we're doing currently to review the current arrangements and then obviously set out the new arrangements moving forward. I would refer colleagues to Working Together 2023 to kind of understand the implications of that moving forward. So to review and focus on the report that's before you, which is the 22-23 report, obviously it is an opportunity for the Safeguarding Partnership to review its current arrangements, how it's working in practice, both strategically and operationally. And obviously focus is on particular areas, including the priorities of the partnership and the arrangements moving forward. And obviously our focus has been very much on safeguarding children and young people in Staffordshire. You'll see references in the report to the local authority, Children's Social Care, to Staffordshire Police and to the ICB, and I'm going to hand over to colleagues to give their kind of update in relation to those circumstances. So I won't focus that on in terms of their role in this session today. You'll see from the report that I've undertaken a series of independent scrutiny arrangements, and those have been focused on the multi-agency safeguarding arrangements primarily, and obviously ensuring that we understand and listen and hear the voices of children and young people. That's something that is quite key to the partnership, and how we work together is part of that. And I've written in my summary around the fact that true engagement remains a bit of a challenge for the partnership in terms of children and young people, but we have got some activity and action potentially in the new arrangements moving forward to address that. I would flag to colleagues that one of the things that the chair of your board and other partners, senior partners and leaders have met as a strategic group, and I'm very keen to ensure that that still continues, even though I won't be the independent chair. It's a strategic group of chairs across the partnerships and boards in Staffordshire, and really key to look at shared priorities, to understand some of the shared challenges that agencies have got across the safeguarding space, but also in terms of opportunities for some joint working. And obviously in that context, I raise the issues around the work around domestic abuse, for example, and also in terms of the current board priority around neglect. But I think there's opportunities that we can still have if we continue to develop that relationship at a strategic level, as I say, as chairs of those various partnerships, to address some of those opportunities. Just in relation to obviously the report itself highlights a number of areas and where we've made some successes. And I'm actually quite pleased, and actually I think it's quite balanced, to also highlight where some of the barriers are in relation to ongoing practice. Some of the challenges that exist are not unique to any one particular agency, but you'll see in the report there some of the things that we're doing to address that. And I do think personally that the involvement of the chief officers in the new arrangements will have and will make a significant difference in some of those areas. Obviously the partnership, the safeguarding partnership, will need to refresh its priorities under the new arrangements, and obviously we need to reflect on the successes of some of the things that we've done thus far. And also then focus on the priority areas that in some ways need to be considered in the context of understanding frontline practice, and really getting a good understanding of how frontline practice is functioning on a multi-agency basis for safeguarding children and young people. There are some cross-cutting areas, obviously, that cut across the Safeguarding Partnership and the Health and Wellbeing Board. Early help with being one of them, and that has to be one of the priorities of the partnership moving forward, and having a look at and quality assuring and assuring itself that those arrangements are working effectively. And obviously you'll see from the report some other areas that there's some cross-cutting elements. Before I hand over to colleagues, I'm happy to take any questions or queries in relation to that very brief introduction.
No, Ian, I don't think there's any questions, so we can carry on through the three statutory partners.
It's a choice about who wishes to go first. Sharon, do you want to kick off?
Yeah, I'm happy to go first. Thank you, Ian. So from a health perspective, we obviously remain committed to meeting our requirements for safeguarding children throughout Staffordshire. And one of the main things that we've done in order to strengthen those arrangements is actually form together as a safeguarding collaborative. So now that's including all of our main health provider organisations and along with primary care. So we can be very consistent about what we're offering, two, how we're demonstrating and sharing learning, and three, how we can act as one health voice. We feel that actually coming together as a collective group, we are stronger in our numbers, but actually we are then able to sort of demonstrate better effectiveness regarding our arrangements and act as one health voice. Our local authority colleagues and police colleagues have often found it quite frustrating within the health economy because it's so fragmented, but actually us aligning together and coming together as a collaborative has helped us in order to act as that one health voice, and we see that just to go on strength by strength in the years to come. So other than that, if there's any questions from the health contribution to the safeguarding arrangements, I'm happy to take them.
I think we'll listen to all three of the partners and then see if there's any questions. So on to yourself, Colin.
Many thanks all. So the key bits I'd probably want to pick up from our perspective is, as of course you may be aware that we've just recently moved out of engaged, and that is in part due to the significant amount of work that's been put in place in relation to the work around the wider public protection, but not least the PPU. So the report does indicate in relation to the fact that a number of recommendations were signed off by HMIC in relation to child protection inspection, and that direction of travel and additional recommendations have also been signed off. So we are in a much better position from a child protection perspective in Staffordshire Police, and that is being partly due to redirection, a significant amount of training, but also a significant investment. So the project that's running the PPU, which is ongoing and I'm the lead of, will see by November 2024, so this November, an uplift of 99 additional officers, which will, whilst not solely focus on the child element, will bring a significant resource specifically into that public protection space. We've built within there and already stood up in March 2024 a CE team. Now that CE team works alongside our established violence reduction teams. We've got a new violence reduction team in the county, and they are now co-located in Lindham with, so you've got your criminal exploitation team, your violence reduction team, your YOS, all at Lindham, working in partnership in relation to those cohorts of vulnerable, criminally exploited and sexually exploited children. So a significant step forward for us. And then training wise, and I'm aware that this is focused on the police, but we've put forward or put through 1,200 officers into some frontline vulnerability training, which had individuals with lived experience of child exploitation in there, facilitating that, and some of our very best experts bringing to home the issues around child abuse, exploitation, safeguarding, and the feedback from that has been absolutely fantastic. And then alongside that, we've obviously been contributing towards some of the work around multi-agency audits, of which we've noted and recognised that we need to do more to strengthen that partnership approach around how we really understand how that system is working. And whilst we feel and have got the resources in the right place from a MASH perspective, we recognise that there is probably some efficiencies and some more work that we can do if we start utilising those resources more efficiently. It's probably the only bits that I wanted to pick up, but I'm again, as my colleagues, happy to take any question from a policing perspective.
Okay, Colin, thank you for that. Neelam, if you want to do your bit, and then we can go to any questions.
Thank you. And obviously my two colleagues and Ian have already given quite a comprehensive overview. I just wanted to touch on some of the issues which really do require a little bit more focus. So certainly in the new arrangements, which, as Ian has said, need to be published by September this year, we have to evidence how we're going to be involving education in our new arrangements, because that's now a requirement. And with such a disparate landscape in the education world, with lots of academies and trusts and free schools, we are working with our education colleagues to make sure how we bring about that coherence. Similarly, the reorganisation and the new working together does give us opportunity to focus much more on performance and also closing the loop. Because what we've done is we've had really good relationships, but sometimes we have struggled to show outcomes. So for instance, one of the things which is mentioned in the report is about the neglect tool, graded care profile 2. We have trained hundreds of people. It's been really well received. It's supposed to be a really good tool. And yet, when we say, so what difference has it make? What are the performance matrix? We've not managed to evidence that. So that's where almost refocusing going forward will help us with that. And similarly, when you see any practice review published, there is still that continuing theme of repetitive things happening, where we didn't share information or we didn't show professional curiosity. So really focusing much more performance and learning from reviews, and how do we make sure that those things are embedded in our organizations is a challenge. And the final thing I really wanted to mention was that some of the emerging complex young needs in children, we actually still have a long way to go in having coherent services. We are still making very much knee-jerk responses, which is case by case. But if anybody was to come along, as was very much highlighted both by the ILACS inspection and the YOS inspection, that if somebody was to come along and say, so how do you as a partnership manage your complex needs young people? I wouldn't be wrong in saying we wouldn't have a very good answer to give. So I think that going forward, developing a coherent system which is much more needs-based rather than diagnosis-based is going to be one of our bigger challenges. Thank you.
Thank you for that, Neelam. So heard from the chair of the board and the three partners. Does anyone have any questions? Okay, if there's no questions, I can't allow that go without a question, but it's a general one, perhaps for yourself, Ian, as having, at some stage soon to stand down from that role of the chair under the new arrangements. What would you see as the areas that the board would need to concentrate on going forward, and what the threats and risks might be going forward, that you, as you see it from that independent perspective?
Yeah. first and foremost, Chair, I would reflect on Neelam's comments there around complex needs. I do think that in terms of the partnership, we have a cohort of children who have got quite significant complex needs in the county that require clearly a multi-agency response. So it's not one agency taking accountability. It's much more of a kind of a joint approach. And, you know, I think it's important that, you know, there are times when that's been a challenge for partners to work together effectively for the needs of those children. And I think that level of complexity is a challenge, but I think it's important that we learn the lessons from some of the children's experiences in the system at the moment, and think about how we address those needs moving forward. That's one area that I think is important. Another area is in relation, which I highlighted, is a focus on frontline practice. So really understanding how multi-agency safeguarding practice is happening on the front line. I had the opportunity and the privilege to meet with all of the area, the district team social workers last year, plus the colleagues in the police and colleagues from the health economy. It was a incredibly useful discussions on individual basis, but collectively a real need to have a connection between the safeguarding partnership arrangements and frontline practice. So emphasise that with the chief officers of the police and the local authority and the ICB last week, in the sense of a real understanding of the purpose of their strategic role and how it influences and impacts frontline practice, because there's a culture that exists in relation to that, which is important to highlight. Thirdly, if we were thinking about children and young people specifically, I do think there is a requirement to be more focused and joined up in relation to how we support children and primarily women in terms of domestic abuse. I think there's a challenge that exists in terms of ensuring that there is that join up, because obviously it probably influences and impacts everybody in the system, and not least the children and young people and the families that we're working with. So I would encourage partnerships to give their focus on that particular issue. And then lastly, from my perspective, is in relation to child criminal and sexual exploitation. I think we need to have a focus in relation to those children and young people. We have possibly 2 ongoing child safeguarding practice reviews around children that have experienced criminal exploitation. There is some learning for us, I think, in the system about how we work with those children and their families, and also work with the networks that they exist within. And a really important opportunity for us to consider that. And then just finally, I would say, and can share Neelam's view around the need for having some really good focused data that gives us, and shared multi-agency data. And in some respects, I kind of am thinking the JSNA is quite a key part of that, in terms of us determining what are the kind of emerging threats and themes in the system. We haven't been able to define that currently. So I think it's really important as a partnership that we work together to identify the areas that we think are the emerging risks and themes for children and young people in the county. And at the moment, that can be a bit of a challenge to understand and figure out. So I think that's the work that we will be doing moving forward in the partnership. And I will, in my role as current scrutineer, obviously will take that responsibility to look at how we can assure ourselves that that's effective and working. My colleagues may or may not have additional things that they think that I haven't raised in terms of themes or priorities. I don't know, Colin, Neelam, or
Chair, not from me. I noted down some of those points, and I think Ian's covered those off. I would just echo the fact that the data element for me is really big. Frontline practice, I completely agree with, and Neelam did talk about that, closing the loop and understanding the impact of the directions and focus that we put on as a partnership. Do we understand really what that impact is? And that's not just about measuring how many people have been trained. That's demonstrated that it's had a impact on the children, and we've got and captured that response from the children to understand that it's actually been delivered and made a significant difference.
Okay, do we have any questions at all? Anybody any questions at all? Okay, in that case, the recommendations from the board was to receive the annual report to understand what the safeguarding partners of the Staffordshire Safeguarding Board have done as a result of the arrangements, including any child safeguarding practice reviews and how effective these arrangements have been, and then members are asked to consider or comment on the process that the board has made since the previous annual report. One further question from myself then, Ian, is with the new arrangements and that, when would you be in a position, and bearing in mind, I suppose this was quite late coming to the board, but the new arrangements perhaps got in the way. When would you next feel it's appropriate to come here?
We have to publish the new arrangements in a further annual report by September, Chair. So in some respects, probably later in the year, if you are meeting, and I would suggest that would also be very helpful, because we will be meeting with the chief officers. I will be meeting with the chief officers in September, and obviously they have the final sign-off of that report as well. So I would suggest that if we can set a date in the autumn, that would be appropriate to do so, and actually probably will be helpfully probably more up to date than it is currently.
Well, yeah, and while you were talking, people were mouthing to me that when we meet in December, that might be an ideal time, because you'll have had time for that to be signed off, won't you? And we'll be able to fit you in. We'll be able to put that on the agenda for then. So if no one's got any other further questions, on behalf of the Health and Wellbeing Board, thank you very much for your attendance today.
Thank you very much.
Thank you.
Okay, so that moves us on to item 5 on the agenda, which is right care, right person. I don't think I go to a board or a meeting or whatever where this subject does not tend to come up. So yeah, Lisa, anywhere there's fine. So Lisa, if you just want to introduce yourself to the board, and then we're all yours.
So thank you for having me back again. I think this is the third occasion where I've come along and provided an update. So I probably know most of you around the room, but just to introduce myself, so I'm Lisa Cope. I obviously work for Staffordshire Police, and I'm the current business lead delivering the implementation of Right Care, Right Person in Staffordshire, representing the Strategic and Senior Responsible Officer, who is ACC Stuart Ellison. So again, do you want me to make a start?
Yes, please.
Okay. So we went live, the phase 1 update, in February this year, and we described the project now in a period of stabilisation. So our concern for welfare calls into our control room have reduced by about 35% on average, which was in line with our as-is and to-be predictions. And just a bit more detail around that. So we predicted about 30% of calls would come from partners and other agencies, and the rest of the demand would come in from the public, about 70% of the demand for concern for welfare calls. And it's pretty much in line with that predictive analysis that we did, in terms of we've got about 27% of the calls coming in from partners and other agencies, and the rest of the demand in from the public. And the calls from the public are a wealth of different sets of circumstances, but in the main relating to mental health, concern for a neighbour or family member, and bearing in mind this is in relation to adults, children and young persons as well. The average number of incidents that we are resourcing have dropped from about 79% to about 55% when we compare it with the information next year. Now there's a number of different factors that we consider obviously when we are going through those principles of right care, right person, to establish whether we've got that duty of care, whether it meets that threshold for police attendance, or whether we are giving some advice or signposting the public or individuals to either another agency, or giving them some advice about the circumstances that they're calling in about. And that kind of trend is continuing in relation to into incidents that we are resourcing, where we recognise there's significant risk to life or harm, or we've identified that there's a risk to an individual at that time. About 51% of that demand that we resource relates to adults, and 70% relates to children and young persons. This data is to the end of April. We have refreshed it recently, but I haven't got that detail for you today, but I will have at various boards that I attend over the coming months and weeks. So just over 4,000 concern for welfare calls recorded from Go Live, and we have an ability to, and this is particularly in relation to partners, more so than the public, to appeal the decision making at the front end, and those appeals go to our supervisors in the control room, whether that be a police staff supervisor or our force incident manager, who's a police inspector rank. And that's where the person on the phone reporting isn't happy with our decision making, and that goes to a supervisor for an appeal. And again, there's been a number of referrals that we can map out as well. And the final bit in terms of phase 1 update is that we have a Power BI product where we can map and measure all the demand coming into us, particularly in relation to where we're signposting individuals to partners or agencies. And that includes obviously the ambulance service, the fire service, social care, and all those partners that we work with, particularly in relation to mental health as well, the 2 trusts and acute. That we're now in a position where we can share that information with our partners, which again I'll talk through in a moment if I may. Just a bit of a national update, and it was really interesting to be present around the previous update, so I can give you a bit of an update around the national picture. So Neelam, you'll be particularly interested in this. There was we in Staffordshire decided that we would apply the same principles around right care, right person for adults and children and young persons. Some other forces and particular partners were a little bit concerned about that. So the national lead through the National Police Chiefs Council, there's been substantial consultation with Local Government Association, the Association of Directors of Children's Services, and the Association of Police and Crime Commissioners. And they've now agreed what those right care, right principles will look like for children, which that the delay and that there's now been an agreement that's been signed, but due to PERDA it's been slightly delayed in its release, but I'm told that it is coming very soon. And it's got those agreed now right care, right principles in relation to children. So what we will do in Staffordshire is when that comes through, we will just do a bit of a stock take with our partners just to assess whether there's any learning for that in relation to our existing principles. The 37 forces in the country have now gone live with Right Care, Right Person phase 1. Obviously, we are one of those 37 forces, and there's going to be the national team through the Police Chiefs Council. There will be a post-implementation review, probably in November this year. So moving on to the next slide. This is just, again, a bit of an update around phase 2. So whilst phase 1 was concern for welfare calls from health facilities, so your GPs and your emergency departments, phase 2 is concern for welfare and walkouts from mental health facilities. That went live on the 4th of June, so a week ago, and it was an extension of phase 1. So all the work that we did with partners around walkouts and AWOLs from healthcare facilities, set us in a really good state for the delivery of this phase 2. And that co-design of that implementation, we've done a lot of work with from leads from both the two trusts, acute, and those from the ICB around what that would look like. It's been really, really a good piece of work. And again, we're only a week into this, but already we can see that particularly the trust, they've done a lot of work to brief their frontline staff around that. So we've had little kind of impact on information coming in from mental health facilities. So so far so good around week 1. We'll do a closure report following the completion of phase 1 and 2. So it'll probably be around July time, and that will obviously include lots of information and learning and feedback from our partners and other agencies. So there's been a bit of change around Right Care, Right Person governance, and this has been, we had our first meeting yesterday that is now chaired by Chief Superintendent Paul Talbot, who is the Deputy Senior Responsible Officer for Right Care, Right Person. And there's been a revised terms of reference for that, and this was around the design and implementation of the further phases of Right Care, Right Person, which the third phase is conveyancing and transportation, and the final phase is management of mental health incidents. And we recognise that this requires much more cohesion with the existing transformational work across the ICB, health and local authorities as well. So new terms of reference, the first meeting was yesterday, very well attended by all partners, and what will happen now is, and I'll talk about it on the next slide, is that we will work through those kind of task to finish activities that will need to design and deliver the final phases of Right Care, Right Person. And then we'll report back to the new strategic board, partnership board, and then obviously report back to the senior responsible officer. So the final slide just talks about the activities that we're going to undertake over phases 3 and 4. I've talked previously about the launch of the NHS 111 option 2 for people in mental health crisis. I don't know whether you've had an update board previously around this, but there's been a national steer from NHS England to not to promote this service. There's a few snags and that they need to work through. So the update is that it's likely to be the winter when there's this national kind of communication plan from NHS England in relation to option 2 on 111. However, we do have that existing signposting, obviously, with the crisis teams in Staffordshire. So it won't really change in terms of our current approach. We'll just be able to signpost people to 111 option 2 when it goes live in the winter. We'll continue to develop this approach for police and health systems to work together, particularly around, obviously, time spent conveyancing and transportation. So one of the agreements yesterday around that piece of work is that West Midlands Ambulance Service is obviously key to that work as well. They weren't present yesterday, but we've agreed at that board yesterday that we would meet with West Midlands Ambulance Service, obviously the two trusts and acute, NHS to work that through in terms of the delivery of that. That said, August is around, that's when we are looking to implement phase 3, which is the transportation and conveyancing. But we recognise the aim is to reduce that 1 hour time that is spent waiting to convey. That doesn't necessarily impact some of our other partners in relation to other transportation of mental health activity. So whilst we hope to make some inroads around reducing that hour, there's a lot of work to do in relation to that. So we will report back to ACC Ellison around the discussions yesterday that we had about the board around that. Obviously, we'll be developing and continue to look at local escalation protocols for those significant system delays that result in people inappropriately under the care of the police, etc. And again, touching on the fourth point, that around data collection and sharing across all other agencies around the development and implementation of Right Care, Right Person. There's 2 pieces of work around it, and it was really useful. Gary, I know you're here today. We had Tim at the board yesterday, and when we talk about lived experience of people in mental health crisis, we've got some really good representation now from obviously the voluntary sector, and Tim spoke about yesterday around a cohort called Expert Citizens, which is through the voluntary sector, and they are very well placed to represent the lived experience of complex multi-agency systems. So we're going to reach out to those organisations as well. And of course, Claire was there from Support Staffordshire yesterday, so we're going to make sure that those conversations are had together. And again, we're continuing to develop what the multi-agency training will potentially look like and linking them with all the other transformational work that is going on across both the Integrated Care Board, the 2 trusts and all our mental health services. So we're in a good position. Again, week 1 of the further phase, but that's the latest update, Chair, in relation to Right Care, Right Person.
Thank you, Lisa, for that. Perhaps for bringing it in for general questions, perhaps we could have some comments how different partners are finding this, perhaps the ICB and children's social care, and then from an adult's perspective, if that's okay. So sorry to put you on the spot, Rachel, but from the ICB perspective.
So from an ICB perspective, I think you're working with our colleagues, aren't you? So I would say that working together is clearly working really well, although personally I don't have the specifics around that, but certainly it informs, I know that you're working really well together. So that would be my feedback from them. Thank you.
Neelam?
Nothing specific has been brought to my attention. And in fact, generally, we worked very well about difficult young people that are well known to all our services, but nothing really on the ground. But I note that Clive is on the working group and feeding into the work progressing.
And Richard, anything from your perspective?
Not much, just to say again that we've really welcomed the approach that the police in Staffordshire have taken to Right Care, Right Person. There's been no impact that we can discern on adult social services as yet. There are some risks that the later phases do have some impact, but I am confident there's dialogue between organisations and that we'll identify and mitigate those risks where they arise.
Thank you for that. So, any other questions from anybody? Okay. If not, I suppose the question then, Lisa, and I am conscious of how many boards and things you must come to. So I'm just thinking of, we meet in September and we meet December and March, and I would be interested, and if colleagues supporting this, in that when we could have a more of a detailed update about the first 2 phases and then the plan for phase 3 and 4, which I think, which Richard's just pointed out, you know, part of phase 4 might be the one that might be a little bit more tricky. So I don't know whether would the September meeting be okay for that?
So I'd certainly be in a position to be able to give you a really good update around phase 1 and 2, because we would have completed our post-implementation review at that point. In terms of the further phases, so August is the kind of timeline for phase 3, and then November is the timeline for phase 4. So probably December board, I would suggest, is probably the more appropriate one around the overall, because we'll be towards the, well, we might not be towards the end of it, but we'll certainly be looking at all the detail around the year so far.
So we've already put something in for December. I'm just wondering, are we going to be okay for December? I mean, because September you'd be able to give an update on 1 and 2, wouldn't you? And your plans going forward for 3 and 4. I'm just wondering, just looking at colleagues, difficult about fitting it in, or what do you think?
We can have a go at that and see if we can fit it into the agenda, if you want that.
Okay, so what we'll do, Lisa, I think we'll have a little think about it and perhaps be in touch with you if we can. So thank you very much for your attendance today. And on a completely different foot, I will be in touch regarding update to informal cabinet, if that's okay. Many thanks. Right, okay, so that's the last sort of substantive item on the agenda. Moves on to item 6, which is the forward plan. And John, are you going to go through that for us?
Yeah, there's a growing list of things for that for the agenda for September. We've just added a few to December as well, but I'll just stick to September for now. Every time we do a substantive review of kind of the 4 priority areas, next time it's health in early life, so that'll be Natasha's side of things. So should be getting a message from me shortly on that one. Baz is on the agenda for Health Watch next time. I think it's the annual report that Health Watch will probably bring to that table. Better Care Fund, we've got that on the terms of reference now for every 6 months, so Better Care Fund next time round. The ICB, there's the annual report, I think is timed in for September at the moment. I think that was the conversation we had with Tracy Shewan, so just to confirm that. There's a DPH report which will be available by September as well, which Richard, I'm sure, will be pleased to say a few words about, which is on workforce and ageing, and then we've got potentially health in all policies.
Yeah, that can come whenever, really, so we can fit that around other things. It's not time sensitive. So.
And right care, right place now as well. I always get that wrong. It's right care, right person, isn't it? Whatever it is, you know what I mean.
I always have to write the initials down at the top of the page, so I don't get it wrong. Yeah, so you are right. Okay, I think we can do some work around those, can't we? See what fits in. Okay, so ladies and gentlemen, thank you very much for your attendance today. It leaves me with one last item, and that's to say a big thank you to Neelam. And she's had a few thanks. Yes. I'm sorry, Neelam. I'm going to. Is that Neelam's been with us as our interim Director of Children's Services for quite a while now. And today is her last meeting, and she leaves the authority on Friday. And I just want to put on record, perhaps on these meetings, my big thanks to Neelam for all the work that she's put in over that period of time, and certainly informed me more about children's services and informed our cabinet here about children's services. And thank you also for your input at the Health and Wellbeing Board in particular. You're more than welcome to say a few words if you want to.
And as some of you have already heard me talk about, that I led Cardiff Council's bid for healthy city status under the World Health Organization. Always been very interested in the public health agenda, along with children's services, of course, and it's just good to see partners working together. And yes, Staffordshire being such a large area, just looking at the diversity, looking at the individual demographics. So it's really good that at least we are around the table, we get the challenges, and more importantly, we are committed to sorting them together. So I've really enjoyed being part of this group and dialogue, and hopefully I've made some useful contributions. Thank you.
No, Neelam, thank you. And so, on behalf of the Staffordshire Health and Wellbeing Board, a big thank you, and we wish you all the very best in whatever you intend to do in the future. And on that note, I'll close the meeting.